Now to India, where authorities are scrambling to supply enough medical oxygen as the latest wave of coronavirus infections stretches hospitals to breaking point. The country logged nearly 300,000 new cases of the virus in the last 24 hours. The uncertainty is such that many people are camping out in front of hospitals where their loved ones are being treated. DW's Nimisha Jaswal reports.
Deserted roads, shuttered shops. Delhi looks just like it did in 2020, at the beginning of India's harsh lockdown. Except now, a year later, the daily caseload is much worse. The national capital has been put under a 6-day lockdown, and silence reigns again. But Delhi's largest COVID hospital is a different story. Even while it is stretched to capacity, patients continue to be rushed in. Many relatives of those admitted here choose to camp out right outside the hospital. They prefer to be close to their loved ones instead of traveling around during a curfew. These women have spent the last few days together. They met on Saturday when both their husbands were admitted with severe symptoms. Preeti Dubey set out at 9 a.m. looking for help. After being turned away from 3 hospitals, she finally found a bed for her husband here 18 hours later.
He's not that old. He's only 33. And even someone like him developed such severe symptoms so suddenly that we thought he'll stop breathing. So someone with pre-existing conditions will be much worse off.
Reena Chauhan was told her husband could not get the dialysis he needed because he had COVID symptoms. She struggled to find a hospital which could treat him for both, as he ran out of breath.
I'm not worried about myself. I just want my husband to be well like he was. I don't want anything more. I have nobody other than him and my 2 children.
Both men are doing better now. Gaining admission to a hospital is already a victory during this surge in cases.
India is currently reporting over 200,000 cases every day. Several states are reporting a shortage in hospital beds, oxygen, and even medicines. Delhi is currently the worst hit city in the country.
The Delhi government is now converting stadiums and schools like this one into COVID facilities to combat the shortage of beds. Each of the 125 beds in this government school will be supplied with oxygen. 1,500 more beds are planned. Doctors here tell us that these are not for intensive care. The hope is that if patients who are stable can be shifted here for observation and monitoring, critical care beds in hospitals can be freed up.
I think we are struggling. Delhi still is trying very hard to maintain a pace with the infection. Main is the speed of the spread. And by this lockdown, I think the plan is to control the speed of it so that the infrastructure or the healthcare facility can match up to the load.
And the load is clearly immense. This 1,500-bed hospital is full. Yet this man, suffering from breathlessness, needs help. He's asked to wait. In Delhi's fight to help people like him, the next few days of lockdown will be critical.
And DW's Nimisha Jaswal joins us now from Delhi. Nimisha, we heard in that report there that hospitals have reached capacity, indeed are overflowing with COVID patients. What's being done to relieve that situation? What sort of scenario are we looking at if infections in India continue to surge?
Well, Terry, each state is currently scrambling to address the sharp spike in cases, especially in dense urban areas. If I speak about Delhi, this 6-day lockdown that the city is currently under is to ramp up healthcare infrastructure. This is what the chief minister of the state said in his appeal when he announced the lockdown, that the healthcare infrastructure is under extreme stress. It cannot take thousands of new cases every day, and that these 6 days will be utilized to ramp up beds, like we saw in the report, in places like schools, banquet halls, stadiums, and also to ramp up supplies of oxygen. But of course, the impact of this lockdown may only be felt later. Delhi reported over 28,000 cases yesterday. Just last evening, multiple hospitals said they had only a few hours of oxygen left. They have still They have since then received supplies, but it looks like day-to-day firefighting, the city, the national capital, as well as the country desperately needs cases to come down to be able to fight this massive surge.
Nimisha, thank you very much. That was DW's Nimisha Jaiswal in Delhi.